Of the two forearm bones, the one located more laterally is the radius. Similar to the previous bones, the radius can also be divided into the proximal epiphysis, the distal epiphysis, and the diaphysis or corpus located between the two. The proximal epiphysis is where we find the head of the radius, known as the caput radii. So, the caput, the head of the radius, and on its head there is an articular surface, which is called the fovea articularis, or more precisely, the fovea capitis radii. If we look at the fovea capitis radii, we can see that it serves for articulation with the capitulum of the humerus, and thus it also contributes to the formation of the elbow joint. There is another articular surface in this area, on the region of the head of the radius, but unlike the previous one, this one is located around the circumference. This is called the circumferentia articularis. The circumferentia articularis will articulate with two things. On one hand, with the incisura radialis of the ulna, and on the other hand, with a ligament, which we will see later. Distal to the circumferentia articularis is the narrowing neck of the radius, which is the column radii, and on its anterior surface, similar to the ulna, we can also find a tuberosity, which is called the tuberositas radii. As you remember, there was a similar one on the anterior surface of the ulna as well, which was the tuberositas ulnae, but this is the tuberositas radii, and a muscle also attaches here. Specifically, the tendon of the musculus biceps brachii attaches in this area. The corpus, like before, is not particularly interesting, but it does have the margo interosseus, this sharp edge, where the membrana interossea stretches between them. The distal epiphysis is more massive, just like the proximal one, and this is how you can orient the radius when you are handed it, by which end you hold. On this, there is an articular surface on the lower surface, which serves for articulation with the carpal bones. Marked in pink, this is the facies articularis carpalis, radii, so this serves for articulation with the carpal bones. And there is another articular surface as well, which is also covered by hyaline cartilage, that is the incisura ulnaris radii, that is to say the distinct incisura ulnaris radii, which specifically serves for articulation with the ulna. So, there are indeed two primary articular surfaces in this particular area of the radius. There is an incisura, or more precisely, the significant facies articularis carpalis, which serves for articulation with the various carpal bones, and there is also an incisura radialis, a prominent incisura radialis, and finally, an incisura ulnaris, which serves for articulation with the adjacent ulna, forming a crucial joint. On the posterior surface of the distal epiphysis, there are distinct grooves, specifically called sulci tendinae, which are quite prominent. These particular sulci tendinae serve a vital function for the smooth passage of the various tendons of the powerful forearm muscles, or more precisely, their presence and formation are directly caused by the constant movement and friction of these very important tendons. The posterior surface, this often observed anatomical feature, the more prominent part of the radius, is also sometimes referred to in some places as the tuberculum dorsale. Another thing worth mentioning here, which is similar to what we saw on the ulna, though there it was located medially, while here it is located laterally, is the processus styloideus radii. Above the processus styloideus radii, there is a ridge called the crista suprastyloidea, because it is located above the prominent anatomical processus styloideus, and specifically known as the distinct bony crista suprastyloidea.